joining us today, everybody. I'm Scott Wickersham.
I'm Erica Bryant. We will get to those other stories in just a moment, but first, we know many of you might be in crisis, needing food for your families. So we want to alert you to a huge resource, an event happening right now. And this is video our Ken Lemon just tweeted from Mount Zion Restoration Church in Gastonia. Out there, they're having a drive-in donation center to help thousands of families. The county's faith-based COVID-19 task force offering 11,000 pounds of food. No one will be turned away. This is certainly a huge help for many in this time of need. Such an uplifting story, and it's even more touching when you hear more from the volunteers and those receiving that free food. Make sure you catch the full story today starting at 5 o'clock here on Channel 9.
And we are asking a lot more questions today about an infected Charlotte paramedic.
Yes, we're trying to learn who they might have been in contact with while they were contagious.
Our Gina Esposito broke that story last night at 5 o'clock, and you're at Medic headquarters this afternoon, Gina, continuing to try to get answers about this very concerning information.
Yeah, Medic says they don't know when that paramedic got the virus. They did say the paramedic did not transport a patient who tested positive for COVID-19. They said the paramedic has been in and out of the hospital and in high-risk situations. Now, the last time that paramedic was on an ambulance working around a patient was a week ago today. I'm told that paramedic took their temperature that morning and it was normal. On Sunday, the employee called Medic to report they had COVID-19 symptoms. That employee then tested positive. Now, with new studies suggesting that people who are asymptomatic can still spread the virus, yesterday I asked Medic why the paramedic's field partner is not in quarantine.
So this individual's partner is aware and was not exposed while the other person was symptomatic, which is good. And so they are tracking their symptoms, and we're managing that employee as we manage all potential exposures within our system.
So they're not being quarantined?
They're not currently under quarantine.
So they're still working on the trucks?
They are still working on the trucks. It was a low-risk exposure. She was not exposed to this employee while they were working.
Now, Medic did give the same reasoning for why patients they worked with that day haven't been notified. I have reached out to the county this morning to see if that will change and waiting to hear back. We know state and local leaders will be talking throughout this afternoon. Medic plans to speak with me in just a couple of hours to talk more about these protocols. We'll have more on their conversation with me coming up tonight at 5 o'clock. Back to you.
All right, Gina, thank you. Of course, while they try to make sure that first responders have all the protective equipment that they need, hospitals are also trying to keep their staff safe in a time when there's a lot of shortages.
Yes, in the last couple of minutes, Goodwill announced it has started accepting medical supply donations. And Channel 9's Anthony Costura is live at a Goodwill in Charlotte. Anthony, you learned this drop-off was actually a local doctor's idea.
Yeah, and that woman is really stepping in to help fill the gap here. At a time when a lot of local clinics are turning to virtual doctor's appointments, a lot of those clinics don't really have a need for that personal protective gear that we have been talking about. But we also know that doctors and nurses are in dire need of those items, you know, things like gowns and gloves and masks. All of those items, again, that we've been talking about. And these doctors are really hoping that folks will look inside of their own homes to see if any of that equipment is lying around that maybe they can donate and help this cause. We've been here for a few minutes, and I can tell you the boxes behind me right now are not super full, but organizers are hoping these boxes will be jam-packed with those supplies. You can drop them off at one of two locations. And this all started when Dr. Sheila Natarajan donated all the personal protective equipment in her clinic. She then set out donation boxes in front of her own home to collect even more. And that is because experts believe we'll see the coronavirus peak in about 2 weeks here in the United States. And she wants to make sure people working on the front lines are protected. But these doctors and nurses need your help.
We scrounged around, tried to find whatever we had available since we didn't need it at our clinic anymore, and gave that to them. And we literally only have days. And so we are trying to amass as much as we can.
And Goodwill is offering up its parking lot on Wilkinson Boulevard in West Charlotte and the one on Lancaster Highway in Ballantyne to accept those PPE donations. You can drop them off on Thursdays and Saturdays from noon to 4. Of course, these volunteers will be out here for quite some time. Erica?
Anthony, thank you. Of course, businesses and some families might have those items at home and might not even realize it, so they'll bring it to donate. Thank you. We do have a tragic update to share with you that we learned about in the past 90 minutes. Gaston County has confirmed its first death associated with coronavirus. Officials say the victim was in their 80s and had underlying health issues, but they have a bit of good news, they say, from the county. They have had 34 positive cases, and almost half of those people have recovered. We want to show you a look at the state as a whole. There are more than 1,800 cases right now in North Carolina, 16 lives lost to tell you about. That is out of more than 28,000 people who have been tested. The most cases across the state are in Mecklenburg County with nearly 500 positive cases. In South Carolina, we're still waiting on them to release new numbers today, but at last check, they had nearly 1,300 positive cases, 26 lives lost. And putting that in perspective, the state has had at least 5,000 tests come back negative. That means roughly 4 out of every 5 people who get tested do not have the virus.
New this afternoon, a staggering amount of people applied for unemployment last week in the Carolinas and really all across the country. More than 6.6 million people applied in the U.S. That doubles a record high set 1 week earlier. The U.S. has now suffered almost 10 million layoffs in the past few weeks. And tonight, this afternoon, I should say, Action 9 investigator Jason Stujenki is joining us live in Cotswold.
And Jason, we know that you've been talking to people for several days who say they're having difficulty even applying for the unemployment benefits.
Yeah, that's right, Erica. The week before last, 3.3 million Americans applied for unemployment. That was a record. Now, as you just mentioned, double that. Again, of course, a record. And just to put that all in perspective, more than 6 million people, what we have done now in 2 weeks, it took us almost 6 months to hit during the Great Recession. Now, U.S. Labor Secretary Eugene Scalia issued a statement saying, quote, "Today's report reflects the sacrifices American workers are making for their families, neighbors, and the country in order to slow the spread." Now, as you said, I've been telling you about all the people having trouble applying for unemployment here in our area. I've been asking the state what it's doing to address that. Around 5 o'clock yesterday afternoon, it told me it hired more staff, it's cross-training current employees to help with unemployment, and it hired a private call center to relieve some of the burden. Now, I also threw the question out to viewers, asking folks who have been able to successfully navigate the system what their advice is for others, so I could share it with all the people who are frustrated out there. 2 of the most common suggestions that keep coming up: number 1, try using Internet Explorer as your web browser, and also try going online late at night or early in the morning. Guys?
Yeah, being patient and also being persistent. It sounds like that's part of the solution too. Thanks, Jason.
A Charlotte woman is now out of the hospital after recovering from COVID-19. Thankfully, Mary Prinz started getting a sore throat last month while traveling home from Germany. Her symptoms got worse all throughout that first day.
I started getting a headache. I felt really hot. My bones were really achy, and it didn't feel right.
Her mom took her to urgent care to get tested for flu, strep, and COVID-19. The COVID-19 test came back positive 4 days later. So she then stayed in isolation for 2 weeks. She says it took her the full 2 weeks just to feel better, but she now hopes everyone can learn from her experience.
I just think people really need to stay home and really take it seriously.
We asked the county health department how many others have fully recovered and are now out of isolation. They told us they don't have an accurate number on that right now.
Researchers say they're trying to figure out if, when, and where there will be more virus hotspots across the country. Some say they think it might hit in Texas or Florida. Both of the states have taken a slower approach to issue the stay-at-home orders. Texas order just took effect at midnight, but experts say it's going to take several weeks to see an impact from that. In the meantime, a former FDA commissioner says the virus likely was heavy in Florida as far back as early or mid-February. Well, now one city in Texas not taking any chances with the virus. On top of the stay-at-home order, the city of Laredo making anyone older than 5 wear a mask when they're out in public. Anyone caught not covering their mouth with some type of mask will be charged with a misdemeanor and fined up to $1,000.
Home Depot is making some changes now to protect their workers and to protect their customers as well. We told you Monday the chain actually was out there putting X's on the floor to kind of indicate how far apart customers should stand when they're standing in line to cash out or other lines. And now they're going even further with some new changes. Stores are going to close early. They're going to close at 6 p.m. so workers have more time to clean everything and then to restock. The company will limit the number of customers inside their stores at the same time, but they didn't give a number of how many they would allow in. They'll also give thermometers to workers so they can take their temperature before they head on into work.